Think about a time when your patience may have been tested. Perhaps you're on your way to work, heading to an important meeting, and traffic came to a standstill. Maybe you're waiting in line at the grocery store, wanting to get home to watch your favourite TV program, and the cashier was going incredibly slow. Or perhaps you were trying to get your children ready for school, and they were whinging, refusing to eat their breakfast or put their shoes on. Now think about how you would feel and how you may respond. Patience and impatience determines your responses to everyday situations such as these, yet it's not something that we think about often. Patience can be defined as a person's ability to accept the realities of a situation and be able to wait for a desired outcome without feelings of resentment or frustration. Impatience, on the other hand, can be defined as a person feeling resentful of a situation, unable to wait for the desired outcome without becoming irritated. Studies have shown that this occurs due to the orbitofrontal cortex and the medial prefrontal cortex. A recent study also showed that serotonin levels may be a contributing factor. There is a lot we don't know about the human brain, and this is where theories come into play. Type A and B personality theory is based on the Myers-Briggs type indicator. This sliding scale looks at 4 categories, and when combined, these categorize as either type A or type B personality. The traits shown between the two are quite different, as you can see on the screen. It is quite clear that people with type A personalities are more likely to be impatient compared to type B personalities. Research shows that mental health, situational factors, stress, as well as well-being can also be of influence. So how can we improve our patience levels? And is this something that can be done on a widespread scale? Dr. Sarah Skiltner from Baylor University believes that both of these are achievable. In her study, participants were placed into one of 3 groups, one that focused on interpersonal, life hardship and daily hustle, one that focused on goal pursuit and achievement, and one was a training program. The results showed an increase in reported patience levels, decrease in reported depression, as well as a positive effect relative to a control condition. This suggested that patience is a modifiable trait. Being modifiable means that there are possible treatment options. However, pharmaceutical options are only available to a person whose impatience is due to a mental health disorder. Non-pharmaceutical options are available to everyone and can include therapies such as cognitive behavioural therapy, amongst others. Dr. Katia Lorena, a licensed clinical psychologist, has the following tips, which is shown on screen, for dealing with impatience. While these won't totally remove impatience, they can help you to control and reduce. In summary, the cognitive processes of patience and impatience can be complex and are not fully understood. These feelings can impact lives and can be influenced by a multitude of factors. Research has shown that there are ways we can modify patience traits, and there are many ways that we can cope with impatience to reduce the frequency and the severity. Thank you for taking the time to watch this video. The remainder of the video contains references that we used when producing.